Hello, my name is Joy Ashby Cornthwaite, and I will be your host for this episode of the live stream show, MyDiabetesHQ Live. Baby and me and gestational diabetes. This unexpected diagnosis can be stressful and frightening. Today, we will discuss shifting that fear to knowledge and action and developing supportive care for healthy mommy and baby. We will also answer questions from viewers live. Today's episode is coming right now. You don't want to miss this. Before we begin, a gentle reminder. The content shared during the MyDiabetesHQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions. This weekly broadcast is developed by and produced by Cities Changing Diabetes volunteers here in Houston and Philadelphia. Both cities are in the network of 25 cities working globally to improve diabetes prevention, care, and management. You can learn more about Cities Changing Diabetes by going to citieschangingdiabetes.org. The purpose of this live stream is to help people with diabetes and their support teams in today's difficult climate. This special broadcast is one that speaks to mothers who are diagnosed with diabetes during pregnancy. We will define what it means to have collaborative diabetes care and education team to help manage gestational diabetes during pregnancy. Since this is my passion and where I currently specialize, I want to clarify that while today's conversation will focus on gestational diabetes, that is just diabetes that is diagnosed during pregnancy for the first time, much of the care planning is universal to all women during pregnancy and after. Since the phrase diabetes during pregnancy also includes women living with diabetes prior to pregnancy, we have, in true volunteer form, managed to strong-arm our physician specialists into an agreement for a future live stream episode, where we will specifically address women living with diabetes prior to pregnancy. That being said, we welcome any questions you may have. Leave a comment and share where you are and join this conversation. With that, let me welcome and introduce today's guests and panelists. Clara Ward, physician. Good morning, Dr. Ward.
Good morning, Ms. Joy. Thank you so much for having me.
Of course, welcome. She's assistant professor and maternal fetal medicine physician at McGovern Medical School, a part of UTHealth. She specializes in providing in-depth personalized care for mothers living with diabetes during pregnancy. Also, we have Miss Siri. Siri, can you say your last name for us?
Jyosyula.
Jyosyula. Beautiful.
You got it.
Miss Siri, whose experience living with gestational diabetes during pregnancy led her to focus on self-care. She will bring to us today into our conversation how she uses that strength and how others can use that strength to support themselves and other peers during pregnancy. She's also a certified yoga instructor, and she follows healthy eating, healthy lifestyles, and she loves to indulge in practices that reduce stress. As always, we are joined by our fantastic MyDiabetesHQ team of Maryanne Strobel.
Good morning.
Good morning, Maryanne.
How's everybody today?
We're well. She's a registered nurse and a fellow certified diabetes care and education specialist. And we have Serena Valentine. Hi, Serena.
Hello, good morning.
Good morning. Ms. Valentine is the CEO of Core Initiative, nonprofit here in Houston, and she is our program coordinator for Houston's Diabetes Peer Support. So welcome, everybody, this morning.
Good morning.
I think as we begin today, first question is going to be out to Dr. Ward. I know her personally, and I think she's fantastic. I want you to share your philosophy of care and how that drives collaborative diabetes care and education to support our mothers to be.
Sure, absolutely. Well, the first thing when it comes to diabetes and pregnancy, we screen all moms because we know that all moms are at risk for diabetes. And so it really, to some extent, like levels the playing field, and it's the same healthy habits that we are, that we can all do a little bit more of. Those are the same habits that are healthy for pregnancy and healthy for managing diabetes during pregnancy as well. And so it's really a blessing to me that I have such a wonderful team with Miss Joy and a diabetes educator, so that we can really all work together to provide patients the support. So when you come to see us with this new diagnosis, which can be really scary, you know that you've got an understanding team that can, will work to find solutions that fit in with the life that you actually lead.
That's great. That's great. And I think we should go straight to our mom, who is now a mother of two, correct, Siri? And
Yes.
who experienced gestational diabetes. How wonderful is this to hear coming from a pregnancy specialist?
It's very good to hear the support group that we have as women who experience gestational diabetes. It's very important for us to lean on this support group, the dietitians and the doctors, and primarily the working out. I don't mean working out per se, but having an exercise routine into making it as a lifestyle, a part of the lifestyle. Healthy eating, working out, or go for a walk. That's what I used to do. I used to walk every day after dinner, and it was very magical in terms of getting my numbers down. And I'm very thankful to the team I had, the team of doctors and dietitians who guided me every step of the way. They held my hand and I followed their instructions to the T. And I was blessed to have that support, and you guys were awesome. You are needed. You are the essential care workers for all of us who experience gestational diabetes. And thank you so much for what you do.
Of course, you're welcome, Siri. That's like the nicest thing that people say to us. We really enjoy taking care of our moms. And I know that, Serena, you had an experience wherein you really leaned on and really had a very great relationship with your MFM. Can you speak to that?
Yes. Well, first of all, I'm not the one that had received gestational diabetes. I was the one that had diabetes before I became pregnant. But I had a situation in where I had to take a certain medication to help the growth of my baby, and it should not have been taken without adjustment. And my regular OB-GYN wasn't seeing eye to eye with my MFM. And so I came in and my MFM found out about it. She found out I started the treatment without her knowing. She actually made a phone call to my regular OB-GYN and they discussed it, and for lack of a better term, and everything got squared away. I'm okay. My son is okay. He's 11 now, so we're good. We're all good.
Yeah, that's great. Dr. Ward, can you kind of speak to the relationship between an OB-GYN and an OB-GYN MFM?
Definitely. So I think, as many people as there are patients, there is many philosophies in terms of, what the best way to sort of approach a patient who's living with diabetes, either prior to the pregnancy or if there's a new diagnosis. There are plenty of general OBGYNs who feel very comfortable with the management of diabetes during pregnancy. And then there are others who prefer to say, let me handle the other aspects of the pregnancy, and I'll refer to a specialist, someone who sees potentially more patients with diabetes, or perhaps has more, novel treatments for these cases that can be a little bit complex. So it's extremely varied what that relationship can be. But I think, to Ms. Serena's point, communication is key. If there's something that concerns you about your care plan, it's really important that you have that comfort level to speak with, your primary doctor, or even bringing that to your high-risk specialist attention so that they can engage in that, that collaboration with their primary OB.
Yeah.
Dr. Ward, how about for the gestational diabetes to develop?
I'm sorry.
Tell us a little bit more. What is the risk for developing gestational diabetes? Can you tell us a little more about the risk?
Definitely. So fundamentally, the number one risk in pregnancy is the baby. All of the hormones that are helping baby to grow during the course of the pregnancy, they're working against your body's ability to process the glucose. So no matter where you start from, you can end up with gestational diabetes. That said, all of the risk factors for diabetes outside of pregnancy are also risk factors for the development of gestational diabetes during pregnancy. So whether that's your family history, whether you're at a higher than ideal body weight, whether that's an ethnic or a genetic component, all of these things can go into increasing your risk.
Excellent. So I had a question from a mom yesterday, where she asked, well, I'm trying really hard. I'm trying really hard to monitor my blood glucose values. I am eating really well. And now I have to start medication. Where did I go wrong? What would you say to a person who comes to you in that, with that type of question, Dr. Ward?
Definitely. That's such a common question and a common thing that we deal with all of the time. At the end of the day, you can be giving A+ effort, you can be doing all of the things, but still find that those sugars are not within that target range that we know to be healthiest for baby. And so that's where we look at, what can we do from a medication standpoint, in addition to all of the healthy things that you're already doing, to help your body process those sugars a little bit better.
Yeah. So I'm going to put this up here. So all of the risk factors outside of diabetes are also risk factors for gestational diabetes. And so, moms who are feeling like perhaps they brought this on themselves, did I eat something that I wasn't supposed to? What did I do to make this happen? I think it's very important that, they know this, and they know this from their physician and from their care team, and just move into support. So all of the self-care behaviors that we use, the self-monitoring, the healthy eating, being active, monitoring, all of these include being really communicative with your care team. And so I think that, your care team can include your own surrounding support team, including your family, your friends, includes the clinical team. I think a lot of times we forget that our physician's nurse is a critical portion of our clinical team. I don't know what we would do without our nurses. They're fantastic. And we all bridge, anything that's needing to be addressed. We have community health workers, social workers, therapists, and psychologists. So all of the things to help support to support moms. And Siri, you were talking about how important that support system is. Did you have, your family support? What levels of support did you have?
I did. I had excellent support from my husband and my family. I'm very thankful and grateful for that. And just wanted to add a little bit further. In the first pregnancy I had gestational diabetes. Second pregnancy, I knew that I would be a very likely candidate to have gestational diabetes, but I went into it anyway. So having said that, we moms, it's a very easy thing to put blame on ourselves, but the focus needs to be on what we can do effectively going forward, even if we are diagnosed with gestational diabetes. The focus should not be on self-blame, but the focus needs to be on self-care behavior, where we can have a lot of impact. We are empowered. Let's take back being empowered and let's empower ourselves with knowledge, with support, and with the behaviors that we can actively and effectively manage the situation we have at hand. So there's a lot of empowerment here just by taking control of where we are. Acceptance is key, as you might already know. Acceptance is key, and when we accept, things get better, much better, and we will be in a stage of empowerment and strength, and we may be able to make better choices for ourselves.
I love how you put that, Siri. I love it. It's really, it lets us know that we're on the right track, right? So we are moms as well. And we can understand, the guilt and the burden that you're making. You're having questions. You question what you're doing while you're pregnant. Am I doing this okay? Am I doing that okay? I think let's pivot now we'll come back to some physical activity, because I know that's, you love having discussion on physical activity, and it's quite an important aspect. It can make a lot of difference during gestational diabetes management. But let's talk about what the care planning looks like from a medical component. Dr. Ward, can you kind of outline what does it look like to care for gestational diabetes?
So I think the first step is really understanding the diagnosis and what it means, what it means for baby, what it means for your long-term health, and what it means for the management of the pregnancy, because it's really hard to implement any kind of, the self-care strategies if you're unclear as to sort of why this is important or why this benefits you and baby. And so I think that's absolutely the first step, is the educational piece. And then with that comes a lot of the things that Ms. Siri was talking about in terms of like empowerment and, being able to, grapple with, with the challenge. From a purely medical standpoint, we do look at like medical nutrition therapy and, all of the dietary components. We also look at physical activity as being, a crucial part. And then we look at medications as well, because sometimes, that can be the key to helping your body do what it needs to do.
Okay.
Yeah, I saw something interesting on the television the other day. They actually made a comment that inactivity is the new risk likened to smoking. I don't know if anybody's heard that, but it was a pretty strong statement reminding all of us the importance of physical activity. So I'm glad that you brought that up. I know it's near and dear to all of our hearts, to make sure that that's part of our everyday self-care.
Mm-hmm. Yeah. And physical activity doesn't have to, be intense, right? Mm-hmm. It needs to be movement. So next week we will have a kinesiologist specialist on, and kinesiology is the study of the human body and movement. And he will have a discussion about physical activity and sort of the details of how that helps to lower your glucose levels and how that improves insulin resistance. But we have to remember that you want to meet everyone in their own space, right? So for some people, physical activity in a group setting may not be ideal. For some people, they want to do individual activity. And for some mommies, they may have to do activity in their own homes. And so there's a broad spectrum of physical activity. This guide is very great because it tells you 115 minutes is the recommendation, 150 minutes for the week, 30 minutes most days of the week if you can. And this moves it into the categories of home, when you're out and about, leisure. Anything that activates the muscles to move is going to help move glucose. The muscles are it's kind of like putting gas in your car and parking it. If you eat and then you sit, food's not going anywhere. Your glucose levels are going to rise. And a lot of people are able to see that when they monitor. But if you eat and you move, it's like putting gas in your car and driving. You're going to burn fuel. And so, for Siri, what she found was a combination of activity and stress reduction, which is the beauty of yoga. And for others, it may just be a walk, a walk outside where you're not at work, you're not surrounded by, things that you have to do in your house. You can do that and still physically distance right now. So there's a lot of different options for moms, right? What do y'all think?
Absolutely.
Serena is, I know that Serena is a huge advocate of physical activity. So what have you been up to lately?
I do right now. I kind of toggle between things because I get bored easily. So I was walking for a while, a 3-mile walk, and now I do HIIT workouts, like 20-minute HIIT workouts now. And so I kind of toggle between the two because, like I said, I get bored. But I know when I was pregnant, I did a whole lot of walking. When I say walking, I walked a lot because I didn't have a car and I was taking public transportation. So I did a lot of walking, a whole lot of walking. And y'all, can I just tell y'all a really short, very short, funny story? Okay. One day I was riding, and this had nothing to do with me being pregnant. I was driving my car and I saw, how you see people running down the street and things like that, jogging. So I saw this lady from behind her. You could not, she just looked like a regular runner. And I passed her up. I was being careful, but I passed her up, and she looked like she was like 7 months pregnant. And I was like, looking at her like, wow. I actually had to roll down my window and be like, is everything okay? Do you need some water? She's like, no, I'm good. And I'm like, oh my God. So maybe it even depends on the person's, tolerance in their body, what they can take. But she was running, she was jogging, and she looked like she was like 7 months pregnant. I was like, what? So is stuff like that safe?
Definitely. I mean, again, the disclaimer, always discuss your personal situation with your regular physician, but absolutely. I mean, my general recommendations to patients are if it feels okay, go ahead and do it. You might be an Olympian at baseline, and so you're continuing to engage in fairly strenuous activity or CrossFit or whatever. It may be that physical activity is new. And so a lot of times I'll be telling patients just really simple nuggets of activity. So dance in front of the TV with your kids, or, pace around like after your meal, or do your heavy housework, or park farther from the door at Target. These simple things that we can build into our lives. But absolutely, if you feel like you want to do strenuous activity, whether it's running or anything else, if it feels okay, definitely.
whoa. That visual just kind of scared me. I'm not gonna lie to you.
What visual?
I mean, she looked like she was like 7 months pregnant. She was about to pop and she's just running away. And I'm just like, OMG, how can she do it? Maybe it was how can she do it that I was thinking about, but wow.
Yeah. And your story reminds me of when I was pregnant with my daughter, and I did the same. I was walking. I was walking near my clinic at work, and I thought I looked so good. I mean, like in my head, I was like moving it, and I think I was like a week out from delivery. So what was happening in my head wasn't happening in reality. And so I was probably wobbling a bit. And someone, a young person, he pulled up and asked me if I needed a ride to the clinic. And I was, it just kind of deflated me a little bit. I was like, I'm walking after lunch. I look pretty amazing.
Yeah.
And so, but I had been a runner. I ran with my sisters in Washington, D.C., pregnant, of course, with like a bunch of mother hens telling me not to go so fast. But it was really, it's do what you love, and then you will do it, right? So we encourage our moms to do what they love, do it daily, do it right after you eat, and help that to move glucose as well.
I was, and you brought it up. You said do it after you eat. So I've had moms ask me if there is a certain amount of time that they have to wait before they do an exercise. They're done eating. A lot of my pregnant gestational diabetes will tell me that they get some indigestion after eating. So that was one of their big concerns. Can anybody speak about the time eating and then exercise?
Yeah, I mean, it's again, if it feels okay, do it. There's no, reason necessarily to restrict, but certainly if if you're not feeling comfortable after eating, or if you are struggling with heartburn, that could be a limiting factor in your ability to really get moving after your meal. But
yeah,
and I used to walk.
We have a question for you. How did you keep fit? It's one of those. Sorry, I just sprung it on you. But it's like do as I say and as I do.
Well, I don't know. Probably more as I say than as I did. But I think, for all of us are living the same sort of challenges. It's like every day trying to be like a little bit better. Trying to, there's days when you're tired and you're like, well, how can I fit this in? Like, what can I do today? What do I feel like today? And there's some days where you just can't do it. And and giving yourself that grace and saying, okay, like I can't do it today, but tomorrow's a new day and I'm going to do it. I would say my main activities, I enjoy like spinning, but I've gotten into running lately since we've been home in quarantine. So
I think you're right. Even, when it's important to have a variety of different activities, because, for example, if your favorite activity is going outside for a walk and then we end up with some really bad weather, then you have to have an alternate activity. So it's not only due to the boredom, but sometimes if it's outdoor related, you're going to have a backup plan for an alternate activity. So I think that's a great input.
Yeah, super. So now that we've covered the physical activity portion, the support, let's talk about giving yourself a little bit of grace with my favorite topic, food. So I always get the question and the concern that, I've been looking online and it tells me that I can't eat, but I'm just so super hungry. Dr. Ward, how how do you approach this? Because I think you have a really great approach, and I know we team up with our patients to do this. But that first question is oftentimes, what can I eat?
Absolutely. And I tell them, we're never going to tell you, you can't eat this, you can't eat that. There's room for all foods. And so that's how I set the stage. And then I tell them it's okay to be human. One high sugar here and there isn't going to make it or break it. You can have a treat. If it's your birthday, you can have a piece of cake. You can have the whole cake, whatever it is. But we have to find that balance. And, different people are going to have sort of a different ability to sort of engage. Sometimes, we've definitely patients where it's like, look, I get home like so late every day after my 13-hour shift. I just grab, whatever's easiest. And then we say, okay, well, can we navigate that? If we can, great. If we can't, what other opportunities do we have to make that work in the context of pregnancy? So no food is off limits. It's all how you put it together.
Yeah, and I make sure that I tell my moms that they're eating food to sustain themselves and also to provide nutrition and growth to their baby. Mm-hmm. And so I'm more of, I guess, I'm not as rigid because having lived with chronic disease like knowledge all my life. I think it's really important that people understand you can mix and match your meals. You can have the veggies that you want. They don't have to be the veggies that you don't want. Here in this picture, I personally love cucumbers and tomatoes, and I think that makes a great salad. It doesn't have to be just a salad. I've had moms come in and say, I'm just eating salad all day. In this one, we just swapped out high fiber pasta. We swapped that one out and added in a dessert because sometimes you feel like a dessert. And this one happens to be a high fiber one, whole grain, with lots of fresh ginger, which helps with nausea. And so on that day, just choose not to have pasta if that's what you're yearning for. And so basing your meals on the strength of non-starchy vegetables to guide you, to provide nutrition, to hydrate you, to give you fiber, and then building on that with a complex carbohydrate, and then a protein, whether it's vegetarian or plant-based, or if it's animal-based. But just work with a registered dietitian to help guide you to your food likes and dislikes, but then with sort of this grace of it's a pattern. I can mix and match. I can have what I want. I can eat with my family, right? So yes. I think Serena and Siri can talk to, because we've talked about this before, about the importance of family support. And if you can't eat what your family is eating, it's very hard to stay engaged and supportive. What do you ladies think?
You can eat what the family is eating, except that the greatest takeaway that I have, and having worked with my dietitian during my pregnancies, I had cup measures. I used to measure everything that I used to eat. And that was one of the greatest tools, if you will, that ensured a safe and a healthy pregnancy. So I would like to stress to the ladies, hey, you are not alone. You can do it, and your cup measures, you can eat everything with the cup measures, and you can eat with the family if you have your cup measures with you. So more power to you, and take back our lives, for a healthy pregnancy.
Yeah, and I think the measuring cups are kind of interesting, right? So I have some moms who are completely willing to measure. They love measuring. They have everything measured. One of the things that if you are not regimented and you don't want to measure, what you can do is measure at least once, and then eyeball it the rest of the time. So certain cups or certain bowls, they may have designs on them, and you can measure, put it in there, and then you're able to see, where the half cup usually falls. And so there are little tips and tricks to make it a part of your, regular life, so that you don't feel as burdened by all of the things that you have to do, because there are many, right? So you're pregnant, you have to, make food for you. Perhaps you have little ones, perhaps you're working, you're checking your blood glucose, you're taking your medication. There's a lot of things to be done. And so seeking the guidance and tips and tricks to make everything a little bit easier, I think can take you a long way.
Yeah.
So
let me tell y'all about it. Oh, y'all, when I was pregnant, I didn't want to do nothing. Okay. So, because when I first got my diabetes diagnosis years before that, I was doing the measuring and all of that. When I was pregnant, I told my MFM, I was like, look, this is what I want you to do. Give me a list of things I do not have to measure. Okay. And I'll eat from that. And she did it. She was laughing at me. She thought I was joking, but I was really serious because I had so many other things to think about. Remember to take my shots. Remember that, I have to leave the house at a certain time to get to the doctors at a certain time. I was going to doctor visits twice a week. And, when you're riding public transportation, if you don't get there on time, the bus is not going to wait for you. And I was not chasing after a bus. Okay. So measuring stuff and counting carbs I was like, I'm not doing that. Just tell me what to eat that I do not have to measure. And yes, it was a very strict diet. When I say it was very strict, because I didn't want to measure. She was like, Miss Valentine, you can eat other stuff too. I said, but I'm not gonna measure, Doc. I'm just telling you, I'm not gonna measure. I don't want to wrap my mind around that right now. So my situation was different. I was like, I don't want to do nothing extra. Just if I can eat that and don't have to measure it, that's fine. That's just how I was when I was pregnant.
That's really great. And I love, Serena, that you just described the importance of communication with your team, right? So your team could have said, they could have thought perhaps she wants to be a little bit more free. Perhaps she wants to do her own food choices. But you wanted something very defined, very definite. And so that's really great that you're able to communicate that, because you can change modes. If I need to give a patient a list, I will give a patient a list. So all this is, again, the communication and the way that we manage glucose. Some people use meal planning and physical activity. They monitor their blood glucose, they eat small meals, they hydrate, they move. Others will have to meal plan and physical activity with the addition of a medication therapy. And this can include oral medication or insulin supplementation if your physician deems it necessary. So there's no, the importance of this is, we can see that you both work together in peer support, Siri, Serena, but you have a completely different tilt on self-management and what self-care with food choices means to you. And that's okay. Yep. It's really okay. I know there's a phrase, comparison is just like a terrible thing to do. One mom living with gestational diabetes is completely different from another mom living with gestational diabetes. And there's a beauty in that. It's one of my favorite things is meeting my moms and just the differences between moms, between families, and how that makes everyone unique and special. So.
Joy, can I ask a question of both you and Dr. Ward? I hear a lot from my other clinicians that they're really confused about the use of fruit and juice, and especially the timing of when fruit can be eaten. Can either of you clarify any of that, or is that, again, very, very individualized?
Yeah, I think that lays into, it may not be one of the top 3 myths, but it's definitely a myth. To answer that, a mom can eat fruit when she wants to eat fruit. Okay. There are different fruit that have a lower glycemic index, or they convert to glucose slower than other fruit. For me, first thing in the morning, I recommend for my moms, if they can, do berries, or a slightly under, like not ripe, but slightly underripe fruit. The biochemistry of fruit is what we're looking at, right? So how is it going to break down? When does it turn to glucose? The berries and kiwis, strawberries, blueberries, blackberries, all of that family have a high fiber content, high water content, and lower sugar. So they're less likely to increase your blood glucose values, especially if you find yourself not moving a lot around those. Throughout the day, when you're moving more, you can do maybe higher glycemic index fruit, like a banana at lunchtime if you're going to walk at lunchtime. It's just really important to talk to your clinician and remember that the variety of food during pregnancy provides a variety of nutrients for you and your baby growing. So you don't want to stick to any one item over and over and over and over again, because you don't get that variety of nutrition. And so I know that historically we've told moms, don't eat fruit in the morning. I mean, I've seen some guides that people bring to me that say don't eat any fruit. That's not beneficial because fruit hydrates you, gives you fiber. You just need to monitor your glucose values, know when and which items are the best to consume, and then work with your dietitian and your nutritionist. What do you say? I'm sorry, Dr. Ward, I kind of took over.
Oh, no, I 100% agree with everything you said. I mean, again, it comes back to no foods are off limits, and just really partnering those foods and sort of budgeting them throughout the day. And as Ms. Joy said, like, there are some fruits where you're going to get more bang for your buck. You know, you can eat a lot more berries than you can eat grapes or something like that. But that's not to say that you can't eat grapes. You know, if grapes is what you're craving that day, or it's what's on the menu, you know, either find a way to sort of minimize that glycemic impact, or you just say, hey, today I'm going to eat grapes and my sugars are going to be a little high and it's going to be okay.
Yeah. And you can, hydrate around that to give your body more water. You can make sure you pair those grapes with a protein. You can use your measuring cup. You can take your list that Serena has that says 10 grapes. You can do all of those things.
Yes.
You just want to surround yourself with that information. And also, different medications act at different times. And so if you know that there's certain foods that have a higher glycemic index, talking to your certified diabetes care education specialist or your physician, you can determine if you need to change the timing of your medication in order to match the peak of that food. So it's not as, I think the beauty of the progression of diabetes care and education and the increasing knowledge surrounding human metabolism and glycemic index has really opened up the world from, those kind of like baked fish and cauliflower of the early days of diabetes to eat what you can, eat what you're loving, eat what you like. So go ahead, Serena.
No, I'm sorry. I just had a question. I just thought about something. Something I've heard in peer support from a young lady who's dealing with gestational diabetes. Like, is it true, like either for a person dealing with gestational diabetes or even a person who had diabetes before pregnancy and still dealing with during pregnancy, is it true that your baby is at higher risk later on in life to develop type 2?
That's such an interesting question, actually. And so one of the questions that I get very commonly is, people will ask, will my baby be born with diabetes? And so the answer is baby will not be born with diabetes. Sometimes they do require an adjustment period after birth where they sort of reacclimate to normal sugars, especially if the sugars have been higher than those target ranges during the pregnancy, but they're not born with diabetes. Now, it's very interesting, and this kind of plays into that genetic risk for diabetes, is we do know that there is an association, there's a familial risk. And so as time goes on, because if you're at additional risk for diabetes, baby may also be at additional risk for diabetes later on in life. And so that just comes down to our basic risk of diabetes. Half of that is probably how we choose to live our lives in terms of, healthy habits and so forth. The other half of it is our genetic risk that we can't escape. And so how do we balance those two factors going forward?
Mm-hmm.
Yeah. Dr. Ward, so I've had patients that mean, well, I didn't have diabetes before I got pregnant. Now I've been watching my diet. I've been doing my exercise. And now you're telling me I have to go on insulin. Why have I failed? And why am I going on insulin? Can you speak to that for us?
Absolutely. I mean, we know that moms who get diabetes during the course of pregnancy have a higher risk of getting diabetes later on in life. And again, that comes down to that, balance between, just whatever hand you're dealt from a genetic standpoint and how you choose to live your life. And sometimes, again, you can be doing all the things and still find that you end up with a diagnosis of diabetes. And now, whether or not insulin or another medication is the best choice outside of pregnancy, that's really a conversation, for your primary care doctor, because there's a lot of new medications that we don't have experience with in pregnancy, but might be great options. That said, I think it's really important not to look at the addition of medications, or in particular insulin, as sort of a reflection of failure. We think about supplementing, and this is something you and I have spoken about before, looking at insulin as a supplement. And, we don't think twice about supplementing the thyroid or supplementing vitamin D, any other organ of the body. So why would the pancreas, which is just not able to keep up with insulin production, why would that be any different? And so it's really important to just look at insulin as another tool in our toolbox to help our body function the way that it needs to.
Does insulin requirements change during pregnancy? So when a woman is pregnant, do they have different insulin requirements, even if they aren't taking supplemental insulin? So how does this all work as pregnancy progresses?
Absolutely. So we know that mom's insulin requirement increases by as much as 50 to 75% during pregnancy. And that's even in someone who does not have gestational diabetes. When we've looked at the insulin levels that moms are secreting, we know that that is increased. And so, it's twofold. One is that insulin requirement is higher. The second piece of it is we're striving for stricter targets during pregnancy, because we know that those stricter targets are healthier for baby. And so you're kind of getting hit on both sides.
Yeah. And Dr. Ward, just to follow up on the target ranges, one of our viewers is asking, so thank you, Quisha, for this question. What are the target glucose ranges for moms living with gestational diabetes?
Definitely. So the numbers that have been associated with the best outcomes for pregnancy and baby are a fasting glucose of less than 95 and a 2-hour after meal glucose of less than 120. Some of it depends on the region. So different places in the country will use a 1-hour after meal target of less than 140. But these are sort of the standard guidelines that we use. That said, it's important to remember that one high sugar here and there is not a big deal, and especially for our moms that are living with diabetes outside of pregnancy, and especially moms living with type 1, those targets might be a little bit different. So.
Mm-hmm. And so one of the questions that came up was, what about the idea of time and range? Is that something that's looked at more? Because some people will feel, maybe their glucose value ranges just around 121 or 122. Is what can be said about this time and range, and how much information do we really know about that now?
Exactly. So this is a huge avenue of research, I think, going into the future. There is a lot of evidence to suggest that perhaps both the time and range, as well as sort of a minimal variation in the glucose, is actually better for health. So that idea that, is it better to have stably but mildly elevated glucose levels? Is that better than striving so hard for tight control that you end up getting low and then needing, to eat a whole bunch of things because it feels bad to be low, and then your sugars are high, and then treating that high, and then you end up sort of on this roller coaster. And so I think there's a huge role for that as we go into sort of looking at, what our targets should be moving into the future, and have we actually been using the best targets, for the past 50 years. But we don't have a lot of evidence-based information yet. But stay tuned.
Yes, that's excellent. And we know that, likely when we discuss pre-existing or moms who live with diabetes prior to pregnancy, we may have the benefit, these moms may have the benefit of having continuous glucose monitors, which are, of movement of technology that can lead us to those types of research questions and answers. And so that's fantastic to know. So before we go, because we're getting close to the end here, do we want to cover maybe just two myths that we haven't covered yet about living with gestational diabetes in pregnancy? What are two myths or two things that you hear people discuss or see on blogs, and you're like quick to say, wait, hold on a second.
Who's the question?
Everyone.
Everybody. Okay.
Yeah. Okay. I think I discussed the one about food. So like, someone ate a cookie and they, I think that's a universal diabetes myth, is that something that you've eaten has led you to live with diabetes. I think one of the other things in pregnancy that comes up, this is a really good one. I had this one yesterday. If I begin medication during pregnancy, does my body become used to it and then I have to be on it forever?
Yeah, that's definitely a big concern, appropriately so. But yeah, no, it doesn't. So your body, at this point, again, it comes back to what Maryanne was saying. We have to achieve these stricter targets during the pregnancy while the body is actively working against you. So the chances that you might need medication during the course of the pregnancy are higher. But then after pregnancy, it's really just important to see sort of what your sugars are and then what you need to be your healthiest self afterwards. So your body's not going to get used to it. You're not going to develop resistance to the medications. That said, depending on, sort of where you are in your diabetes journey, medications might be helpful after the pregnancy, even if you didn't need them beforehand.
Do women should they come back and see their OB and get a check on their glucose again after pregnancy? Is it like 6 weeks, or is there a timeline, or what is your recommendation for women after pregnancy?
Definitely. So the standard recommendation is 6 weeks postpartum. And I'm so happy that you brought it up, because it's a very important piece of the puzzle to sort of see, has the gestational diabetes indeed gone away? Or are you really grappling with insulin resistance or glucose intolerance that's going to follow you out of the pregnancy? And so getting to that 6-week postpartum visit is really important from the diabetes perspective, as well as all of the other health benefits to making it to that visit.
Will you do any type of special testing at that time for their glucose levels and their tolerance?
Yeah, so the standard testing is a 2-hour oral glucose tolerance test. So it's a 75-gram load of carbohydrates, and then there are certain thresholds for looking at that going into the next step when you meet with your primary care doctor.
Okay. And should women who've had gestational diabetes have A1Cs done? And can you say what an A1C is and talk a little more about that as women continue, in their lifespan after had just diabetes?
Yeah, definitely. So this is such a important point as well. So the hemoglobin A1C is the glycosylated hemoglobin, and it essentially is a reflection of what your average glucose has been over the course of the past few months. And it's the number that's used to sort of know where you are on the spectrum between pre-diabetes, overt diabetes, and it's been tied to, numerous complications both within pregnancy and outside of pregnancy as well. That said, it is just sort of one number in time. So I think that goes back to the points where we discussed earlier in terms of the variations and so forth. We do not typically use the hemoglobin A1C to monitor glucose control during the course of pregnancy because it's physiologically decreased during pregnancy. It's always going to be a little bit lower. And we don't routinely test for it as part of our prenatal labs, but I think it is such an important piece of the puzzle just from an education standpoint to letting moms know, what is their overall risk and how they can best place any new diagnosis of gestational diabetes within the broader context of their life and their health. So I feel like it's an important piece of the puzzle that we perhaps don't use enough in our education and our counseling.
For sure.
Thank you.
Thank you so much for that wrap up, Dr. Ward, because I think that we oftentimes forget as moms, as new moms, maybe not forget, but we get busy. You've got a newborn, you've got maybe other kids, you're getting back to work, and you forget that there's also you. And the phrase that Siri kept using about self-care, it's really important that we extend that out. It's not, I've delivered, I no longer have gestational diabetes. I don't have to do anything about my self-care. You want to take that knowledge that was built during your pregnancy and those habits and behaviors that you developed into the rest of your life, because it can impact you. It can impact, I think one of our viewers, Quisha, said that her husband also has begun taking care of himself as well. And so it really extends all of the behaviors that you practice can extend to your children and your significant other and maybe a friend, all of those things. Mm-hmm. So is there anything else that we want to tell our viewers before we log off? I know we'll be back to discuss diabetes during pregnancy. So what to do and how to take care of yourself and treatment modalities when you're living with diabetes before pregnancy. But is there anything else that you all want to give? I think this is really great and useful information this morning.
Mm-hmm. I would like to add a few things. There are beautiful prenatal and postnatal yoga DVDs available. Please make use of any and every information you can get hold of. You don't have to go to an extra class. You can do it something at home, whatever helps you. But please consider movement, active movement, physical activity into your lives. And it has tremendous impact. It impacted me tremendously. I used to walk after my dinner, after 1 hour after my dinner when I'm lighter, after had considerable impact on my blood glucose reading. So ladies, do it for yourself and your newborn. I completely wish from the bottom of my heart to have a beautiful, wonderful, and most exciting.
Thank you, Siri. I don't know if I told you, but I did. I practiced yoga for both of my pregnancies. And then my
Wonderful.
daughter actually went with me to baby yoga class, but that's a whole different situation. I'll talk to you about that later. But we went to baby yoga when she was about 3 months old. So, so anything else, Dr. Ward? Any parting recommendations or thoughts for our mommies who are living and with gestational diabetes?
No, I mean, I feel like so many really great points have been, raised here today. And I think it's really, finding a care team that you can partner with and just, again, we're all human. The advice that we give during pregnancy is the same stuff we should all be doing a little bit more of anyways. And it's those incremental steps that are so meaningful in generating lifelong change, because that's really, our goal is for everyone to be their healthiest self. So
excellent. Thank you all for being here this morning. It's that time where we have to say goodbye to our viewers and to our guests, but I just want to say again how thankful I am that Dr. Ward has taken time out of her incredibly busy schedule to spend some of her free time with us here. It's her way. Is to go above and beyond for patients, and also our peer support coordinator, our peer supporter, Siri. You all just never quit. And I think that for mothers, for moms, for women, for men, for families, you do your best and your greatest. And I'm just incredibly thankful for you. And Maryanne, of course, how wonderful I think your work is. And just this entire panel today, I'm just in awe of the work that you all do for people who are living with diabetes. And thank you for taking the time to give this special topic that's very close to all of our hearts a go this morning. So thank you.
thank you so much for having us.
It's been a great start to our Saturday morning with yet another talented panel of speakers. To our viewers, we hope that this conversation has made you think about your self-care in a different way, and perhaps even encourage you to reach out and help someone, a mother who is living with diabetes during pregnancy, and continued gratitude to our friends and colleagues who took time to share this morning. Mark your calendars. We will be broadcasting again, as we do every Saturday, 10 a.m. Central and 11 a.m. Eastern. Our next episode will air next Saturday, October 3rd, and that episode will focus on physical activity, and we will feature Dr. Mark Stoutenberg, PhD kinesiologist and department chair at the Temple University School of Public Health. Thank you, everyone, for being here. Thank you for being a part of the MyDiabetesHQ community. Like and subscribe so that you know when we post our videos, and we'll see you next time.